After pregnancy, the World Health Organization recommends a 24-month interval before your next pregnancy. Ask your healthcare provider about the right birth control that matches your desired birth spacing, your health status, and your overall goals. Your menstrual period might start anywhere from 6 weeks to over 6 months after delivery. Exclusively breastfeeding decreases the odds of getting pregnant, but pregnancy is still possible. There are many safe birth control options to use when breastfeeding. If you are planning on having more children, birth spacing allows you to devote appropriate attention to your current baby. It also allows you to optimize your health to improve the health of your next baby. Continue to take your prenatal vitamins every day until you stop breastfeeding. You may continue to take stool softeners as needed or until you have finished all the medication from your prescription. Stop taking them if your stools become loose like diarrhea. Narcotics are not prescribed often, but if they are, do not take them while driving or with alcohol. They may cause drowsiness and may also cause constipation. Ibuprofen or NSAIDs may cause stomach irritation. Do not take them on an empty stomach. Do not take them if you have problems with ulcers or have a bleeding disorder. They may also cause some constipation. We hope you have committed to a smoke-free environment for your newborn. Children who live with smokers have an increased risk for ear infections, asthma, and pneumonia. If you need help quitting, reach out to your primary care provider who can help you find the right resources. The transition to motherhood can trigger a mixture of powerful emotions, from excitement and joy to stress and anxiety. Many new moms experience postpartum blues after childbirth. Symptoms may include sadness, irritability, feeling overwhelmed, crying, difficulty concentrating, fatigue, sleep disturbances, stress, anxiety, and mood swings. These emotions usually subside after about 2 weeks as mother and baby adjust to each other and hormones level off. Feeling down may be a sign you need more rest. One way to combat the postpartum blues is to request for someone to care for your baby while you treat yourself to something that makes you feel good about yourself. You may just need a hot shower, a sitz bath, to get out of the house for a short walk alone, or to take a brief trip to the store without interruption. Postpartum depression, a more severe form of emotional distress, affects 10 to 20% of new moms. Symptoms may include a depressed mood, intense irritability, anger, severe anxiety, loss of appetite, isolation, marked changes in sleep like insomnia or too much sleeping, feeling like you cannot take care of yourself or your baby, severe loss of energy, feelings of worthlessness or hopelessness, excessive worry, or thoughts of harming yourself or your baby. Postpartum depression isn't a character flaw or a weakness, and women who experience it are not alone. Highly effective treatments are readily available. If you think you might have postpartum depression, please reach out to your healthcare provider. If you ever have thoughts of harming yourself or your baby, please contact your healthcare provider immediately or go to an emergency room. If during your hospitalization you were treated for a pregnancy complicated by high blood pressure, please follow these instructions when you go home. Maintain all follow-up appointments with your healthcare provider. Take all medications as prescribed. Monitor your blood pressure if requested by your healthcare provider. Call your healthcare provider if your blood pressure is greater than 160 systolic, which is the top or first number, or your blood pressure is greater than 110 diastolic, which is the bottom or second number. You have a severe headache or dizziness. You have blurry or double vision, see spots or auras. You have serious difficulty catching your breath. With so many changes occurring at once, this can be a confusing and sometimes anxious time. Most of these changes are totally normal and will pass in due time. Calling your healthcare provider shouldn't be necessary unless you have the following: the chills or a fever over 100.4 degrees Fahrenheit, difficulty or pain when you urinate, urinating frequently with only small amounts of urine each time, heavy, bright red bleeding saturating more than 2 pads per hour for 2 hours in a row, fainting episodes, redness or severe pain in the breast area, if you notice blood or pus coming out of your nipples, pain, tenderness, redness or swelling in your calves or thighs, if you require an increased amount of pain medication with time, or if you feel you might have postpartum depression. Thank you so much for choosing UCLA Health during this wonderful and momentous time in your life. Please don't hesitate to contact us if you have any other questions or concerns.